Hi, I'm Amy Slatter, a student of Exercise and Sports Sciences, Central Queensland University, Australia. They say that it's all in your head. Remedy comes from the idea of satisfying the needs of someone in form of medicine. That the expectations of what individuals hear about something assist in quitting a substance as addictive as cigarette smoking, or caffeine. The placebo effect has been proved to work in many settings, from medical and painkilling to sport and physical performance. Through experience or verbal suggestion, it is proposed that the subject anticipates the outcome. With a copious amount of literature based on the placebo effect, it has been detected in many that it does in fact exist. It was found to have a positive and negative effects on cognitive response based on the suggestions to subjects that they received more or less sleep than they actually did, while also having a positive effect on muscle pain, where it was detected that the thought of applying an analgesia agent gave peace of mind to subjects. Bartels et al. 2014 also established that, like pain, the suggestion of itch induced the placebo effect. Though only a handful have studied the placebo effect on maximal and submaximal strength, psychological-based expectancies were found to be existing in an investigation on steroids and strength, while more recently, following the investigation involving the use of sports drinks, it advised the importance of broadening our understanding of potential impacts this effect could have on sports performance. The aim of this study was to investigate and increase the knowledge around strength performance of the upper and lower body, while the hypothesis being, with the basis of Keller, Saunders, Reed, and Fitzpatrick, where maximal strength was tested through upper and lower body strength exercises, that the placebo effect will cause a difference in strength. The experimental approach that was taken towards this included, within subjects' design, testing 1 repetition maximum leg and bench press exercises, along with 80% of the 1RM leg and bench press, with recordings of nutritional data prior to the testing session. 15 college-aged men participated to be in this study, all being apparently healthy, with the entrance criteria of evidence that they were, at the time of testing, currently performing upper and lower body strength training for 3 days per week, 6 months prior to testing, along with signature proof that no ergonomic aids were consumed 6 months prior to testing. Procedures include, firstly, a familiarization session, giving participants an idea of how testing was going to run. Participants reported to the laboratory between 8 and 10 o'clock and cycled on a Monarch ergometer bike at 60 watts for 5 minutes. Prior to each 1RM lift, participants performed 2 warm-up sets of 10 repetitions at approximately 50% of 1RM. Following warm-up, participants' 1RM was assessed within 3 to 5 working sets, with 3-minute rest periods given between sets. Once 1RM was determined for bench press and leg press, participants were given an additional 3-minute rest period prior to performing muscle endurance tests for bench and leg press. To test muscle endurance, participants performed as many repetitions as possible, with 80% of their 1RM for bench press and leg press, respectively. Prior to all muscle strength and endurance tests, participants were advised to utilize proper lifting technique, which was verbally described and demonstrated by the experimenter. During each lift, verbal encouragement was provided by the experimenter. For a lift to be deemed successful, participants had to ensure proper lifting techniques was performed according to the standards set forth by the National Strength and Conditioning Association. After this, they were given a food diary to fill out 3 days prior to the baseline testing. Baseline testing consisted of the same procedure, except participants were given another 3-day food diary and sugar tablets being the placebo. They were informed that the tablets were consumed of a powerful amino acid compound that has been proven to increase skeletal muscle strength and endurance by 10 to 15%. Participants were instructed to consume the supplement 3 times per day and were given a supplement adherence log to complete to ensure the supplement was being properly consumed. Testing session 1 then consisted of the same procedure, except this time, when given the sugar tablets, they were informed that another university just completed an independent study on the supplement and found the supplement to have no effect on skeletal muscle strength or endurance. Participants were told after all testing sessions the truth was given to them. Statistical analysis performed had the alpha level set at 0.05 with repeated measures ANOVAs run on all data collected. Post-hoc testing used Tukey's honest significant difference. Firstly, in relation to 1RM testing, results indicated a significant difference within baseline and testing session 1 and baseline and testing session 2 for both bench and leg press, with no differences found within testing session 1 and testing session 2. It was also found in 80% max testing that significant differences were established within baseline and testing session 1 and baseline and testing session 2, with no differences again found within testing session 1 and 2. In terms of reps at 80% max testing, significant differences were found within leg press baseline and testing session 1 as well as baseline and testing session 2, with no differences established within reps at 80% bench press testing. There were also no significant differences found within nutritional data of kilocalories, protein, fat, and carbohydrates consumed 3 days prior to each testing session. The same outcome of previous literature based around strength arose in this investigation. Even with additional endurance measures, the same outcome applied. As far as these previous findings go, we know that the placebo effect is existent, though the brain activity around this has not been specified. Benedetti and Emenzio reported that similar biomechanical and cellular changes in subjects' brain activity were alike to a brain induced in drugs. This knowledge found in a medical setting could assist in a sporting performance setting as well, though also mentioned was that methodology plays a critical role in different results found in particular studies such as this. That informing participants of all potential outcomes that could happen impacts the way they may think and expect. In terms of this study, adding an extra piece of information, such as stating that the findings have not worked for everybody, may change the way that they think and how it affects the results. This could be an approach for future studies. In conclusion, the placebo effect was established in the study, and suggestions based around reasons for outcomes have added quality thought into theories of this effect. With a strong argument in communication of methodology, this is a solid reason and agenda for future research. In terms of practical implications, the information of this study could essentially assist people around the area of fitness. The importance that psychological factors may have In terms of practical implications, the information of this study could essentially assist people around the area of fitness about the importance that psychological factors may have on successful physical performance. Thank you for listening.